Okay. Thanks. Claire?
Oh, dear. So, hi.
Hey.
I've come twice before, and each time I begin my remarks by thanking those of you who have been in this struggle for a long time. And John Rowley is now here today, and thanks to you, John. But if I haven't said it also very clearly, to thanks to my fellow community members who are not paid, and I want to thank you, Gino, as you walk out the door, for doing that every day in and day out and night work of being a community member who literally saves lives. And I want to acknowledge people. I just think of my neighbor Sharon, who I just left on Elm Street, and all that she does unpaid work to build the fabric of the neighborhood and the community. And I believe literally saves lives and keeps people out of harm's way and out of jail. I think it's really important to acknowledge how grateful to meet some of you here and to know more of the details of what you do, and to imagine that all of that stuff is like you're talking with human beings every day, and this is hard. And yes, it makes me tremble because it's some of the hardest stuff. But what we have here is this community of incredibly creative, intelligent, heartfelt, lived people who are adding to this collective wisdom. So yes, let's open to it and not contract to it, but open to it and be grateful. And I just want to thank you all who've led this movement to resist mass incarceration, which Paula points out is a trend. It's not, it's like those figures bear out. This is not somebody's just feeling or opinion here. We incarcerate more people. Now, you've heard all of that before. Those statistics maybe are worth repeating every time and not as a question to you in the session. But on a very practical, tiny little question point, I want to know, can we see the blueprints for this expansion? I would like that to, I'd like to see that blueprint. I would also, I'm particularly interested in this outdoor rec area, having spent time in federal and county prison, federal prison and county jails. It sounds really humanitarian, and yet when you don't get sunshine for days and weeks and months and sometimes years, you've been denied a human right. That's my feeling. And those really slick-looking things, I don't know what it looks like. I would really like to know what it looks like.
Two things. Is that on the website?
It is, although it's in a committee. It would be, you'd have to dig for it to find a committee. We've put the PowerPoint online, easy to access. What we can do is we can bring the plans for the jail, the renovation, into the same place, so you'll be able to see it on our webpage.
Okay.
But in terms of sunshine?
Online?
I think we had a presentation at the legislature
That's what I will
meeting,
put.
and that would be online if we could find the date.
It is, although, again, you'd have to dig for it. I'd like to make it as accessible as we can. It's that presentation. There you go.
There you go.
Thank you. Thank you.
And Claire, just to answer your other point, it's a 3-sided covered outdoor facility, but there's other space outside it where you can get sunshine.
Okay.
Yeah. Okay. And you can stay under it out of the rain.
Okay.
So, yeah.
Great. So earlier, I think it was Joanne, thank you, sorry, that asked the question of Mr. Moriani about the use, maybe it was Paula, that could you take those capital fund, the bonds, and apply them to OAR? And you answered correctly that no, they don't translate. And yet it was explained to me that the 10% that would be needed, or in this case 20%, I guess, no wait, 50%, every year you would have to be paying back that bond. You have to have the cash on the budget to be paying back that bond. So that percentage is available to put to OAR. Right? Wouldn't that be?
So you're saying if we didn't borrow the money, that means that there would be $65,000 a year of debt service that wouldn't be incurred. You wouldn't spend it.
Right.
So you're saying that would give the county the capacity to do.
Right.
And the only thing that I would say in response, understanding your point, is that we believe that by investing this money in the jail, there can be savings that will offset at least some of that, and we think probably all of that cost. So if you didn't do this renovation of the jail, there are really lost savings there. So again, I just want you to understand that there are two parts of it. One is new cost, but there also is an opportunity to save money that's currently going to other counties to board our inmates.
Maybe.
Go ahead.
Could I just make one quick comment? OAR is supporting the addition of the 7 beds, and we're doing it on a humanitarian basis. We have 90-some people in custody, 8 of whom at least are out of our county. We're a really little agency. We can't get to those people. We can't get them attorneys quickly. We can't get their families there to visit. Their families can't make phone calls. I believe in the macro big picture that you build that they will come. I understand that. I understand the over-incarceration of Americans and all that. But I also understand that those people, largely women and juveniles, are people who we can't assist. And that's unconscionable for us.
So I just have one last remark. Thank you. And that just as a personal commitment, the bigger picture is really important for me because we are here as the Public Safety Committee and we've all talking also about human rights and that this is a human rights issue. And in that same vein, and I've said it before, but it's, again, a personal commitment to always bring in this picture of what is public safety, what is human rights, and what is real crime is my big constant question. And I would suggest that what is not bigger than us, but part of our question, is what we spend as a nation our money on. Economies of death. This is a little graph that the Quakers make. I'm trusting that it's accurate. And it shows a nation that spends 60% of our money, the people's money, on military, an economy of death. And that isn't even including the prisons. Okay? So that's why we don't have money. That the people who will fill, the 2.3 million people who fill our prisons and jails, are what I would like to say on the receiving end of crime. And that's not to diminish, because I live on Elm Street. I have neighbors. I have people that suffer with all of the ravages of poverty and racism and the other things that have been put before us. So I'm not diminishing that. But I truly believe on a spiritual level, if we who are so privileged not to have some of those things and we're not targeted and being put in jail ourselves, that if we held accountable this big crime, we wouldn't have to be patronizingly helping those who are the victims. I think there's a strong corollary between that. And I'm not saying that this is just a conversation in this room, but it is a personal commitment for me not to talk about it without also, for some reason, the microphone read. But that's the fuller picture.
Okay. Thank you. Yeah.
I understand with back and forth, the 3-minute time limit has kind of gone out the window, but some of us have to leave. We could try to limit some of this. I have questions I've been waiting for.
You were reading my mind. I have 4 from the public. If we could do these quickly, if you've got a question to ask, please ask it. We'll get it answered. I know there's There's a couple of legislators that have been sitting here listening to the dialogue. They want to do what legislators do, and that is to comment, and rightfully so. And hopefully we can wrap this up within a half an hour. And I'll preface that by this obviously is not the last conversation that we're going to have. It's a continuing dialogue. It should be a continuing dialogue. So, Neil Woolley.
Hi, my name is Neil. I live in the city of Ithaca. To me, a lot of what we're talking about comes back to basic logic, and I'd like you guys to reconsider the logic of this. And I'll give you one example of something that was said here today. The question was, where is the city of Ithaca's chief of police? And someone said, well, it's not the police that put people in jail, it's the judges. Okay, that may very well be true. But as a simple question of logic, how do people get before the judge before they get put into jail? Let's look at the logic. Let's go back to the beginning. Not just the state pushing this mandate on us, but what else could be done? And let's look at the big picture and look at how it's being done in other places. Not just in this country, but in other countries as well. Thank you.
Thanks, Neil. Chantel Thomas.
Thanks. My name's Chantal, and I live here in Ithaca. And since the hour is late, I'm not going to mention some of the points that I had wanted to, especially because both Mr. Robeson and some of the others on the legislature have said that this is just the beginning of a continued dialogue, and that's great to hear. So hopefully there'll be more time to discuss the substantive points. So I had submitted the list of 8 questions to you, and some of the questions were answered, some weren't. I won't ask the substantive ones at the moment, just focusing on process. One question would be, will the next episode in this dialogue be held at an hour when working people in the community can attend? So in other words, after 5 p.m. or after 6 p.m. And when will we know when that next session is scheduled? That's one question. And the second question is just the first one that was on the list that I submitted, which is the Public Safety Committee prepared to conduct a study of the reasons for incarceration and whether alternatives to incarceration have been pursued to their fullest extent? And Mr. Robeson, you had answered, I think, in part by saying that members of the legislature, the committee, and the agencies who are here study the matter on an ongoing basis. That's a bit of a different point because it's sort of a noun versus verb distinction. So it may well be, and I'm sure that you all do study the matter on an ongoing basis and are committed to it in many ways. Conducting a study is making a series of findings that are publicly available and published in the form of a document that can be subjected to scrutiny. And my understanding is that studies have been conducted in the past. So Mr. Mariani had said that there was a 2002 study and several other studies, but that the last one was towards the end of the last decade. So that's 3 or 4 years ago. And so it seems that a precedent has been established of best practice, which is to conduct a study before further steps are taken. And that would be a good thing to do in this case. So the question was, is the committee and the legislature prepared to conduct a study and issue a study on this matter?
Well, I think your first question was regarding meetings. And go ahead, stay up there. Regarding meetings and when the meetings occur and things of that nature. As I said earlier, we're about to get into a season where everybody's going to be taking a pretty needed break, I think. Mm-hmm. And we're going to regroup, and we may literally regroup, and it will be under the purview of the next Public Safety Committee meeting where the steps go from there. With regards to the time for this meeting, these meetings are set virtually. These meetings were set in January and publicized. They happen once a month, more often if necessary. Quite frankly, they're for the convenience of the staff, and it's to conduct. You didn't see much of it tonight, but most times there's a normal county business that takes place. And this is extraordinary for anybody that's been to a public safety committee meeting. But nonetheless, it will be the responsibility of that committee, that chair.
And so the idea is, so the suggestion that has been raised has been to actually go outside of the established schedule and enter into an intentional and focused dialogue with the community on the jail expansion. So these would have to be, I think, specially scheduled meetings, and hopefully there's a commitment to make those meetings at a time that people who work during the day can attend them.
I guess I'm saying that could happen, but it would be the commitment of an unknown group at this point.
So you can't take responsibility for making a commitment to that issue.
I can't name myself to the committee. Martha.
Yeah, I think the public needs to really understand. One of the things that happens at a committee meeting is that the committee members discuss with each other, and that has not been able to happen. So, Brian cannot. He could make a commitment, but he'd probably be lying. I don't think we want him to do that. Nobody knows what the committees will be a month from now, or even 3 weeks from now. So that's an anomaly. We happen to be in December. So I think there will be plenty of time for the new committee to absorb this information. I will point out that Will Burbank in the back is also a legislator, and I'm also not on this committee. Carol's not on this committee. So right. 3 of us are here who are other than the Public Safety Committee for 2013.
Yeah.
The information. Look, it's late. The process is going to continue. Nobody here can make a commitment to you, except that I think there's certainly a will that we will continue discussing all this with the public.
I think that's fair enough, and you all are smart and talented people, so I'm sure that you can overcome the barriers of procedure and focus on, I think, the outcome that has been recognized as being important, which is to somehow create a forum for people to attend after the end of the working day, and I won't belabor that point further, but thank you for the response. And then just the second point on issuing a study that would make findings and conclusions on the basis for incarceration of the current jail population.
Susie, what was the study you did in 2007? I think was the last one.
The strategic action plan where we looked at the entry points into the system. And out of that came some of the reentry work for people coming out back in, assessments in the jail, innovative things that many of the other counties are not doing. And it was very productive. It was done very systemically. The other thing that we have periodically looked at are scientifically proven programs that work. And what we found were things like multi-systemic therapy, MST. We were already doing it. Yeah. But if members of the public have information internationally or, other state-wise programs that work, feel free to bring them to us. We are always looking.
Yeah.
We are always looking for things.
And just one final thought on that is that I think that the point here is that it's important to conduct these studies on a regular basis. So if the last one was issued 6 years ago, it's not to say that everyone here isn't doing their level best to achieve all of the goals that we've agreed are important, but that a regular period of self-assessment may be necessary, and also just as a matter of procedure before a decision is taken of this magnitude that the community cares about this much, that a document should be issued explaining the bases for that decision. That would be my opinion about best practices and also practices that this legislature has followed in the past. So I would hope to see that. And
okay.
I will leave the floor. Thank you.
Point taken. Gwen, you had something?
Yeah, I wanted to, first of all, thank everybody for their input today. And I'm thinking about the comments of Claire. Hi, Claire, wherever you are out there. And Chantal, that's you, right? And Dr. Nagel, is it? I've undertaken a study regarding paradigm shift, theories of punishment, and underlying issues that drive incarceration in our country. Certainly, these are issues that are kind of meta to some of the stuff we're talking about today, but they're important nonetheless. I'm currently working on a project regarding the DWI laws in this country, taking into account different philosophies of prosecution and punishment, as well as international law and different cultural contexts for dealing with this behavior. Some of the things we've talked about tonight touch on exactly this, and those three people that I mentioned are the ones whose comments resonated with me in a way that I think would be a good starting point for some more discussions. I'm not on the legislature, but I am in a position to think seriously about our approaches to crime in this county. So if any of you are interested in talking to me, and I have no power to increase or decrease the number of beds in the jail, I would be interested in having those conversations. And in closing, I'll say, I won't meet with you for 3 hours late in the evening, but I will meet with you for 3 hours really early in the morning. and also, well, no, that's enough for now. Thank you.
Can I just say, this has all been, in my eyes, really good stuff. This was supposed to be a discussion, and I think it has been a discussion. However, the folks that you... Hang on, Joanna, I'll get to you in a second. The folks that you've been talking to haven't had a chance to respond, and I mean legislators. So I'm going to give an opportunity, whether you're on the committee or not, for just a quick couple of minutes on what you've heard and any thoughts that you might have. Go ahead, Martha.
I have some factual questions, and I maybe can go quickly through them.
Yep.
There's a really, really important distinction between sentenced and unsentenced, and pre-trial and post-trial. You've got on my graph, my page is 21. The average length of stay of unsentenced. The average length of stay of unsentenced individuals, and then there's the graph of length of stay. That includes, and maybe this is a Gwen question or a Judge Rowley question, that includes people who have been before their trial and before a plea is agreed to.
That's unsentenced.
That's unsentenced, but unsentenced also includes, am I right, people who have been convicted or agreed to a plea before the sentence happens.
That's correct.
So what's the average length of time between that decision of guilt, which a plea is a decision of guilt, so is a conviction, and sentencing?
Theoretically, for incarcerated inmates, the PSIs are expedited. It used to be 4 weeks. Is that still right, Pat? All right. So 4 weeks for an incarcerated person's PSI, meaning somebody who's sitting in jail unsentenced.
What's a PSI?
Oh, sorry. Pre-sentence investigation. Pretty in-depth look at factors that the judge would consider for sentencing.
But they've been determined guilty.
Yes.
So this question of are you incarcerated before you're innocent till proven guilty, at that point there's a determination of guilt.
Mm-hmm.
Okay. So in these data on unsentenced individuals, is there any way to know how much of this is before guilt and how much is after guilt?
We have not been able to parse that out yet. We'll continue to work on that. We did throw a footnote, though, on that one slide to note the fact that the population that we're talking about includes those who have been convicted and are awaited sentencing, a process that can take 4 to 6 weeks. So we tried to get that in a footnote so that's recognized.
And that time while the sentencing is being discussed is part of their...
All the time they spend in jail is credited against any sentence of incarceration that they receive.
All right. So anybody who's looking at that needs to understand that's a mixed number.
Yeah, if bail is set, that event triggers the crediting of every bit of time against an eventual sentence.
Okay, thank you. How many days, if somebody is, and these alternatives to incarceration programs are all voluntary, correct? That somebody has to, the inmate has to want to participate. If let's say there's a judgment of rehab, that somebody should go to rehab, do we know how many days somebody might spend in our jail waiting for a rehab bed? I know it fluctuates, but...
No, we've got that data. Dina Bodner has calculated that as part of Casey Monahan's work. And actually, I was complaining at one point that it seemed like it was taking longer, but the numbers are pretty much about the same. I think it was like 23 days or something. But that data is available. It is actually a remarkable process because we're talking about a lot of pieces, a lot of moving pieces, because there has to be a prosecutor, defense attorney, defendant, and judge who are all on the same page with that. There has to be the evaluation that's done if the person's incarcerated at the jail. Then there has to be the Medicaid public assistance piece, which OER is a big part of, and the coordination of all of that. And then ultimately, when there's a door-to-door, which happens almost every day from the jail, where people are sent from the jail to treatment, the sheriff's staff actually do that work. So it's quite a complicated process. It works very, very well. I mean, all of these points could be increased, marginally with more money, but this is how it's allocated at this point. But that system does work quite well.
So some of the time somebody spends in jail maybe waiting for that process to go through and waiting to move to rehab.
Yeah, but no question. But it's also not necessarily time wasted. It might be their second or third time going to rehab. So we say, look, you can be sentenced out at any point. You're going to go to prison. And they say, no, I want another chance at it. I say, well, it's going to take a long time to get to St. Joe Saranac Lake because that's the best treatment facility in the state, and that's the one you need. And there's a waiting list. I say, I'll wait. And in fact, the time at the jail, where there's AA meetings, there's NA meetings up there, there's an opportunity for them to at least do some reflecting. Sometimes it's straight out detoxing. And people do better when they go into rehab clean than when they walk in off the streets still using.
Thank you, Judge. On the construction estimate of $900,000, maybe this is a joke question, about how much is for the beds, the renovation of that room, and how much is for the outdoor facility? Or maybe
Rella's here. I think the costs are concentrated on the outdoor facility. Well, is it, I don't know, 2/3, 1/3 maybe? Yes. Outside, inside, 2/3 outside, 1/3 inside?
So about $300,000 for the inside renovation, about $600,000 for the recreation area.
Order of magnitude, yeah.
Okay. There's a big question here, and Deb said it a minute ago, and I think this is kind of at the foundation of all of this, the idea that if we build the beds, the system will fill them. I certainly believe that when it comes to, the kind of jail that we rejected of 134 or 196, there are a lot of different numbers passed around that we rejected some years ago. I'm not sure that's relevant when you're talking about 7 out of, this 90 beds our 73-bed facility. But I guess I would ask, especially Judge Rowley, to talk about that. Because the theory is that if you have a big empty jail, all along the system, people will make decisions that say, well, you got room in the jail, just put them in the jail. Judge, do you have a sense that happens here either, as a general matter? Do you think judges, magistrates pay attention to jail population when they make those decisions?
100% not. I mean, the last thing I'm going to do is call the jail, see if they got room for them. Those are so separate that it's inappropriate. I said this once at a hearing about the jail where they said, well, you got to take into account taxpayers and stuff. If you send someone up there and they're full, it's going to be a board out. But that can't be part of the decision-making process. I'm looking at the variety of things that have to do with the bail factors that the district attorney talked about, the options that we have, this person's history. I mean, day reporting is an incredibly valuable resource. If I can send someone to day reporting, I will do that. If it's a day reporting with electronic monitoring, we'll do that. Whatever the variety of choices we have. But it's also if it's a case of violence where there's where the likely outcome is going to be state prison sentence, those cases are more likely to see more substantial bail. But I have no idea on a daily basis what the jail population is and have no interest in it.
All right, thank you. And I just would want to make two other comments. One is that I think it is the point that it's been a while since we really did a comprehensive study is fair and appropriate. And I think we have a really top-notch system, but it could probably, maybe it can be better. I think it's everybody here is committed. All the professionals in our system are committed to doing the best we possibly can. I think it's a good time to do a reality check. And is there anything more that we could do? So I hope that we can pursue that in the coming year as a legislature. And I, personally, I will, as chair of the legislature, I'm not actually on any committees. I won't be chair of the legislature next year. I will ask volunteer to be on this committee. I hope that I will be part of it, part of the discussion. To members of the public, and thank you all for bringing these issues to us. I really, really urge you to go to sit in some of these 20 town and village courts. We've heard you. Go listen to the other folks. Go talk to them. Go to Albany. Go talk to the Public Safety Committee of the New York State Association of Counties. Go talk to your legislators. You've raised issues here. We're going to pursue them. We're going to work even harder than we already do to make this as good a system as we can, as fair and just a system and humane. But the low-hanging fruit is other places. I really urge you to get involved with other counties, and hope you'll do that.
Peter Stein.
Yeah, I had a bunch of comments to make, but I'll just make one so that other people have time. The question of the scheduling of this meeting and with the notion that is there a problem? Do we really want to meet with the people that we represent? And I'd like to give you my own point of view on that. We schedule, we schedule lots of meetings in the evening. Every time there's a construction project for a road, we bring out we go to those and meet the public and talk about it. During budget time, we have a lot of meetings in the evening where people can come in. And I think that we are, for myself, I can say that I don't have enough contact with my constituents. It's not a question. I would really welcome more. And as far as I meant to respond to Gino, he invites me to come down and talk to Southside House or anyone else about what I know about Public Safety Committee, I'm certainly will be willing to do that, and I'm sure that any of my colleagues would as well. I don't really think there's a problem there. And if we think we want some kind of a discussion like that, or if some of you think we want some kind of a discussion, you should approach either the chair of the legislature or the chair of the Public Safety Committee or whatever is appropriate, and I'm sure that we will come out and meet and talk with you about it. Basically, that's what I wanted to say.
Jim?
I just want to say thank you to all the members of the staff, the judge, the DA, the sheriff who came out here and talk to us. I think what the public has to recognize is that we have this in our budget as a capital project with no dollars affixed to it. And we have 5 months or 6 months to look at it and decide what it's finally going to look at, or what it's finally going to look like or not look like, as a matter of fact. We're not done with this, and the talk will continue, and clearly every elected official here will want to take part in that because it has an effect on taxpayers all over the county, and that's why we're all here.
Pam?
Well, I guess I wanted to say that from my perspective, the issue that we are looking at, to me, I guess my focus and the thing that I really see as the problem is the number of people that we have in the jail. And that just sort of looking at some of the figures and some of the bail, the levels that are set for what I would consider minor charges. No, I'm certainly not an expert at this, but this is just my initial looking at this, is that there seems to be, perhaps there are ways that we can reduce further the number of people that we have in our jails. And frankly, if we were to reduce the number of people in our jails by a third, I would still want this renovation, because that recreation space outside is something that will benefit the inmates there. The room, whether it's used for beds or whether it's used for a meeting place for people to do coursework, to meet with their lawyers. There's a lack of space in that jail for people to live. And so I would still be in favor of this project under those circumstances. But I think that the point where we need to work here is to look at the high bails. And why is that happening to violations and misdemeanors? There are other ways that we can reduce the number of people who are sitting there waiting trial.
Yep.
I'll add my thanks to everybody, staff as well as the visitors who've come. Joe, I sent you an email a little while ago asking if we could have some information just to start off the big picture of our study. Looking back over the last 10 years, dollars spent per year on our ATI programs. We went through a crunch after 2008. Everything contracted then. So let's look at total, how those have gone down or bounced back or not. Secondary, you can look at direct ATI programs, but you also then would have to do some kind of thinking, which is harder to do in numbers, about programs that affect the numbers in our jail. A homeless program, food security. If you broaden that net, how have our human services and community support programs in general fared over the last 10 years compared to what we're spending on the jail and public safety? Where's that balance and how has it changed? Would be interesting to know. In addition to other things that might come out of further discussion.
Thanks. Can I ask, is Paul Berry or James Hicks, I think? Ricks?
Just in time. Yeah, I was listening. There were a few things that I found upsetting. Before I even got here, Gino had told me about requesting, I think for you, sir, I don't know your name, but you seem to be running things, to come to the South Side. And you said well, when you said, yeah, if I bring the police chief, I took that as a racial slur, or that you felt like you had to be protected when you came to the South Side. I heard you explain it in a pretty politically correct way just now, that the police are the ones that make the arrest, and so that he should be there to explain it. Then I heard somebody else say that the police, aren't the ones responsible for the people that are going to jail. It almost feels like a game of three-card Molly going on here. Like who's responsible? Is it the judge? Is it the police? And if you listen to some of the tapes, like from Stop and Frisk, they had a court judgment against Stop and Frisk because it was racist. And if you heard some of the police speak about some of these children as they approached them, they had like tape. They were tape recorded, and they were talking about these kids like they were in an occupied country, that they had to demonstrate who was in authority around here. One officer was saying, like, why are we going to bother these kids? So we got to show them who's in charge here. And I think when they bring those kind of kids in, if they say, well, what the hell are you doing? When they get in front of the judge, they're going to jail. One officer was saying they're not doing anything. Another one that was saying that was brought before his commander, and the commander told him to get with the program. So I'm saying, well, that was in New York, okay? And I mean, everybody here sounds so caring and considerate, but it seems like we're talking about dealing with the effect of a really racist, jacked up system, and some pretty rough police that kind of enforce it instead of the cause. And I think that's what we're trying to get to, the cause. Dealing with people is no matter how humane it is after they've been through an egregious social disparity, economic disparity, educational disparity, and to talk about how to house them humanely is a troubling concept for me to deal with. I kind of would want to get to how are they in this position in the first place. I think that's kind of more important. I heard some gentleman say that he had to put some lady in jail that was pregnant to help her. I guess she's a drug addict and maybe she'll go out and hurt herself. I can see at that point, yeah, well, maybe we need to do something, but what the hell happened before she even got to that point is what I'm wondering. That you have to say, do I have to put this woman in jail to help her save her baby? Somehow I think this issue could have been addressed before it got to that point. To incarcerate somebody for their own good is a scary concept. I'm saying, well, what in the hell are you taking them from to put them in jail? What is so bad? How is their life so miserable that jail is an improvement? And I think that's some of the things we need to start addressing also. I was in the Sean Green group. I am in the Sean Green group. We had a workshop. We had a young black girl, right? She lived in a black neighborhood. She said she didn't see that much crime and whatnot, regular police and whatnot, but the family did well, and they moved to an integrated neighborhood, upward mobility. She said, man, it was more underage drinking and house parties with drugs all over the place, but nobody ever got arrested. And I'm addressing somebody, I think it was you again, sir, that said that you go to the area where most arrests take place. That area is where people are most policed. You put a lot of police watching people every day, you're going to get a lot of arrests. And who knows for what. Can depend on the policeman's attitude that day or any other number of relative things. Okay, so I definitely wanted to say that some of the language that's being employed here, like the area where most people are arrested, okay, that's code for the black neighborhood or where poor neighborhood, that's the area where people are most policed. And I think that those things need to be addressed too. Okay? Gotta go.
Thank you.
That wasn't a question.
Thank you. Will, I saw you hop up to the table.
Thank you, Brian. This young woman, do you want to speak? Or?
Go ahead.
Okay, thank you. So I'm Will Burbank. I'm not on the committee, but I have really appreciated the thoughtful discussion and presentation, both from all of our staff people and agency people, but also from the audience. I am heartened that we live in a community where we ask this kind of question. I can guarantee you that in communities all over this country, this question is not being asked. Typically, the question is, we have a crime problem, why don't we just put them all away? I think we are, it's very good that we're doing this. I hope that, and I've heard a lot of very, very thoughtful, intelligent comments from the folks, the public that are asking these, that are challenging us to consider an alternative to this jail renovation. I do hope that you have heard back some of the complexity of what we're dealing with, that many of the factors are completely beyond our control. And we are trying to make a smart decision that is genuinely not only economically smart, but humane. And this discussion will continue in the coming months. I've been impressed by the fact that people have come and come back again. That takes a lot of effort. I hope you will continue to engage, but also if you see areas where we can genuinely do things to address just the forces that are sending people into jail that we have control over, by all means speak with us. And please recognize that many of those decisions are made by other bodies and put pressure elsewhere. Thank you.
Thanks. Yeah. Go ahead, young lady. Just please state your name when you get up there, please.
I'm really nervous. So my name is Carolina, and I'm here today because the day I found out about the jail expansion, I also saw an article in the paper that said, "Where will our mentally ill go?" And this is what concerns me as someone who has been faced with arrest because I wouldn't comply to going into an ambulance. I am here to speak up and represent the mentally ill community. Elmira Psychiatric is closing now, and I can't help but feel like there's a correlation between jail expansion and the poor, horrible state of our mental health system. And I'm actually going back to college for psychology and politics, and I want to work on these issues in the future. But it's just, I guess my question is, I personally do not feel safe right now. I know this is the Safety Council, and I feel like I'm an intelligent person and I have merit in the community, but how many people are there in the jail system that are mentally ill and are not getting the help that they need? Green Street, there are so many failed mental health programs in this community. Meanwhile, there are ones that could be successful if they had the funding, such as this little private peer-run group called Space, who is completely lacking funding, and I'm actually going to be helping them this year with fundraising. So as an intern for school, and it's just like, what are we doing? And there's been so many successful therapeutic programs. We've been talking about the jail, and we have mentioned almost nothing about prevention. And we have mentioned, and there's other situations where I've been in where it's just been atrocious, which I don't want to mention in this 3 minutes. But yeah, so I'm here. I guess I want to state my personal story because I'm here because I'm gaining awareness about what's going on the other side, because I feel like things aren't being done. So basically, I'm wondering about prevention and also if within the jails, if there are what is happening to the people who do need psychiatric help, because we've mentioned all these programs, but isn't that the main staple, rehabilitation? Aren't we trying to rehabilitate these people and integrate them back into society?
Okay. I'm sorry, what's your last name?
Carolina Grunberg.
Okay.
Yeah, I can. Do you need?
Yeah, that's fine. Yeah. Who wants to take a quick stab at that one? Susie? Judge?
Just real quick, I have conversations with Elmira Psychiatric Center and some other facilities when we deal with our juveniles. And your point is very well taken. And I can tell you that we share that. I can tell you that Elmira Psychiatric Center is not definitively closing. I was told today that they are reevaluating because we need a facility like that in central New York. And it is proactive concern, very well justified. So it's being restudied. So thank you.
Judge, did you have some or no?
Well, I can just say that, there are mental health services provided at the jail on a daily basis. There's a psychiatric staff there, a psychiatrist that's available. People are provided medication there. It's not a particularly good place, to say the least, for a mentally ill person who's actively experiencing symptoms, and it certainly aggravates symptoms. And frankly, that was what I was talking about with the state prison system. I know a number of people who work in staff positions in the state prisons, and the mental illness there is rampant, and the conditions are pretty rough. The less options we have, less good options. With the closing of institutions like Elmira Psych, they're trying to say we've got better options. But until we have the better options, they're making things worse by closing institutions like that. And we've been through this routine before in other areas. So I don't think there's a direct connection between our beds and that closing. But if the help is not good, inevitably mentally ill people will cross paths with the police and end up incarcerated. That's the reality. That does happen.
And I can say that there's all forms of government, not the least of which is the State Association of Counties, that are lobbying very hard so that those facilities do not close. Joanne, did you have something quick?
Yes, very quick.
Okay.
Thank you for letting me speak again. Thank you, the woman who just spoke about that. And Mr. Robeson, you said in your last meeting that you're very aware of there's a lot of people in jail right now in Tompkins County who are suffering with mental illness. In your words, they shouldn't be there, but we have no place else to put them. I'd like to know what really the people here today are doing personally to make sure that those places don't close. And the other thing is, New York State right now, Tompkins County especially, Finger Lakes region, is a destination for people to come from other states on vacation. And other states that surround the state of New York have done away with ridiculous laws for marijuana use, which is actually a very successful treatment for many mental illnesses and for physical illnesses. So for Judge Rowley and maybe D.A. Wilkinson, how do you handle people who come in to New York State from other regions and are arrested for possession of marijuana, and how are they handled here? Do we prosecute them here, put them in jail here, or do you send them back to wherever they came from? And secondly, why is that a good idea to arrest people in New York when we know that a few miles down the road what they're doing is absolutely not considered a crime at all? And in fact, it's considered a treatment.
With respect to the prosecution of people who come into Tompkins County with marijuana who aren't from here, the jurisdiction of the case is here, not where they came from. The jurisdiction for the offense is here. Marijuana crimes in New York have been substantially deregulated.
the legislature has not yet seen fit to completely deregulate or even legalize the use of medical marijuana or the use of recreational marijuana, as has been done in other states. While as DA, I have considerable discretion about the way in which I prosecute crimes and other offenses, I am not empowered, nor do I think it would be ethical, to just say I'm going to ignore all of these certain kinds of crimes because I don't think they should be crimes. That's not my mandate. That's not what they pay me for. I will say, and I think that public records bear this out, the prosecution of people who possess or use small amounts of marijuana is very low priority in Tompkins County. It is, for very small amounts of marijuana, it's not a crime. People are entitled to an adjournment and contemplation of dismissal. For the
It's a violation.
It's a violation. Right. Ticket.
I just want to understand.
Yep.
And let's say my brother is 72 years old. He lives in Connecticut. He comes to see me.
Yep.
And he may use marijuana for his cancer treatment. So he doesn't want to come to New York to see me until after that is completed because he's afraid of being arrested in New York State for using a treatment for cancer. Yeah. So I wanted to know do you write him a slip or do you say, now you're going to have to come back to New York to appear?
Well, the reality is that if he is using marijuana in a residence for therapeutic purposes, his risk of arrest is small, or non-existent probably. If he was cited for it, he would receive an appearance ticket to appear at a certain time and date in a certain court, and he would have to appear here.
So he would have to come back from Connecticut for a citation for marijuana use?
He would for an unregistered car or for a parking ticket.
Yeah.
I've got two marijuana cases pending. One's 10 pounds and one's 50 pounds. Those are the cases that make it to the felony level.
Mm-hmm. I just want to make sure that we're not, putting people in jail for long periods of time on a violation here, which is not a violation in a few more miles down the road. I think that would be egregious. Thank you.
It's a legislative issue. And
state legislature.
Right. I was just going to ask, is that New York State?
Yeah.
So you're off the hook?
A state legislature. Right. These guys absolutely cannot legalize anything.
Okay. Thank you.
Thank you.
Unless somebody's got something real pressing, I think we'll go ahead and adjourn. I want to thank everybody for coming out, especially staff here. Hopefully we've answered a lot of questions, and just remember that the discussion is not over. We'll see you in January. Motion to adjourn. 1, 2. There you go. Thank you.